Stacy.
Good morning, or actually good almost lunch break. My name is Stacy Christensen, and I am the managing editor of JAMA and chair of the AMA Manual of Style Committee. And I'm honored to be here to discuss our reporting guidance about race and ethnicity. My co-authors, our disclosures and affiliations are listed there. All right. So identifying socio-demographic variables is important, race and ethnicity, age, sex, and gender, to help readers identify what the population is in a study and how generalizable those study participants are. And reporting these variables also helps with identifying any inequities or disparities in healthcare and research. So previous research has found limited progress in the reporting of race and socioeconomic status in research published in medical journals. So our study looked to compare reporting race and ethnicity in 3 JAMA Network journals before and after we published formal guidance on race and ethnicity in August of 2021. So by way of background, there was a study published in JAMA Network Open that looked at all randomized trials in JAMA, The Lancet, and the New England Journal of Medicine in 2015 and 2019. The authors sought to determine changes in the reporting practices for age, sex and gender, and race and ethnicity, as well as socioeconomic status. Those authors looked at 688 trials. And while more than 98% of those studies looked at included information on participant sex, only about half reported on race and ethnicity, and less than 15% reported on socioeconomic status. So those authors concluded that limited progress has been made in the reporting and representation of race and socioeconomic status in medical research between 2015 and 2019. The impacts of systemic racism in medicine are being acknowledged, and it is imperative that we address this important problem. So at the JAMA Network, we published the AMA Manual of Style to codify guidance and policy, not just on style, but also best practices in reporting medicine. In the 9th edition, which was published in 1998, we actually included information about racial and ethnic information reporting, in that they should be always they should not be used automatically, that authors should explain and justify racial designators, and perhaps in the methods section of the manuscript, and terms should be used accurately. So when race or ethnicity are mentioned, they should be relevant to understanding the scientific information. They should be sensitive to designations that individuals or groups prefer, and that researchers should be aware that preferences change and people in those groups may not always agree with the terminologies that may be used. So that version of the style book in 1998 acknowledged that race and ethnicity are cultural constructs. The 10th edition, which was published in 2007, emphasized also the importance of explaining how study participants were classified, including providing examples of where to phrase this information. And then in February 2020, in our 11th edition, the guidance also stipulates that authors should explain why race and ethnicity were categorized, and also by whom. We also encouraged authors to report this information in the results section. So after the style book was released in February 2020, as you know, a lot happened in the world. And we looked at our guidance that was just published, and we decided that we needed to quickly do an update. So the first thing we did was to change the capitalization recommendations just a couple months later. And we also looked at the entire chapter, and we did a deep dive into revising the entire section. We revised it, reviewed it, got a lot of DEI input, and came up with draft guidance in February 2021. We got more feedback, more revision, and our final guidance was published in August of 2021. So we took on this major update to a just published manual because it is really imperative for medical and scientific journals to use equitable, fair, and consistent language when describing race and ethnicity. So inclusive language supports diversity and conveys respect. Language that imparts bias toward or against persons or groups based on demographics should be avoided. The guidance that we published includes definitions of commonly used terms associated with race and ethnicity and acknowledgement that these terms and definitions change and will continue to evolve. We acknowledge concerns and controversies in healthcare, including the intersectionality of ancestry and heritage, social determinants of health, and other institutional, cultural, and demographic factors. The importance of identifying specific racial and ethnic categories with a preference for study participants' self-selection, the use of collective terms for racial and ethnic groups, capitalization, abbreviation use, alphabetical order are all discussed in our updated guidance. And we provide a host of examples to help researchers, authors, and editors use correct terminology. But we know we also need to continue to collect feedback and provide more examples as terminology evolves. So back to our study. We looked at all major research articles published in JAMA, JAMA Internal Medicine, and JAMA Pediatrics in 3 months of 2019 and the first 3 months of 2022, as well as the 3 months immediately before the guidance was implemented in May through July of 2021. Articles were reviewed independently by 2 reviewers for the following: if the study included humans, if reporting of sociodemographic variables was included, where in the articles race and ethnicity were reported, such as the abstract methods, tables, figures, or results, the number and order of racial and ethnic categories reported, if other race and ethnicity was included as a category, and if the article indicated how, why, and by whom race and ethnicity were determined. So we looked at 249 articles that included human participants. And as you can see, higher percentages reported study participants' age, sex, and gender. Reporting of race and ethnicity improved between 2019 and 2022 from 57% to 67%, but this was not statistically significant. There was little change in the reporting of socioeconomic status, ranging from 37 to 44%. Our results specific to reporting race and ethnicity in the research articles had varying outcomes. For example, the proportion of articles reporting specific racial and ethnic categories was higher in 2022 at 62.8% than in previous years, but this also was not significant. The proportion of articles that included the other category ranged from 61 to 64% for all years. However, while in 2019, only 26.7% of articles defined the specific racial and ethnic categories included in other, this increased to 70.4% following release of the initial guidance in 2021, and it increased to 84.8% in 2022. Presenting race and ethnicity categories in alphabetical order, which was a new policy, increased from 8% of articles in 2019 to almost 93% in 2022. Explanations of how race and ethnicity were determined in a study significantly improved after release of our guidance. So in this analysis, higher proportions of articles reported how race and ethnicity were determined and listed categories in alphabetical order following the implementation of our new reporting guidance. Some improvement was shown before 2021 and may have been due to some internal communication before the final implementation, as well as the early draft published in early 2021. Overall, race and ethnicity were still underreported compared with how often age, sex, and gender were listed in these articles. Socioeconomic status variables are still underreported and are grounds for future research. The AMA manual will continue to expand our coverage of inclusive language regarding participants in all of these areas. Thank you for your time and attention.
Thank you. I guess I'm the first one. Thank you for the amazing presentation. I have a couple questions. First, did you observe any differences between RCTs versus observational studies in terms of reporting, sex and race, ethnicity information? Second question is that guidance only applicable to JAMA articles currently, or is that something you're planning to expand further? Like, I don't know.
Two good questions. The first one about stratifying by whether it was a trial or any other type of original research. I don't have that information handy, but we can go back because we have all of our data, and we can certainly take a look to see if that's a factor, or there are a number of other things that we could probably look at to see if there were any determinations by article type or by study type. The second question is the AMA manual. While it is a product of the AMA and the JAMA Network, we have made the race and ethnicity information freely available. So it is freely available on the AMA manual website, as well as in a JAMA editorial. So it's free access. Anybody can use it. We encourage others to adopt some of the formal guidance. And we've worked with some other style products to share our information. So worldwide, all kinds of different resources will be able to use similar guidance. So it is freely available. We highly encourage you to take a look and to see how you can adopt it to your publications.
Hi, David Schreiger from UCLA and also from JAMA. The point or question that I had was, did you look at the papers as they came in as opposed to how they were published? That
would be a great study.
Because one of my tasks at JAMA is to review the tables and figures and edit those, and along with Steve Schenkel, who's sitting over there. And our workload in this area has not gone down. So it's not like the authors are reading the manual and then delivering us manuscripts that are correct. It's that we've read the manual and we are changing the tables during the peer review process. And so I think that makes an important point relevant to this whole Congress, which is there are lots and lots of things where you can put up a best practice in any realm. But if the peer review isn't active and the editing isn't active to fix it, it doesn't get fixed. And so, I would argue that I'm not so sure it's the publication of this as much as it is the determination within the network that we're going to enforce it. It's the active ingredient.
It is still rather new, so things like this do take time to catch on. And this is just one area. So we have a bunch of sections. We have one on age and sex and gender. And when they're all, updated and publicly available, we could probably make some checklists for people to use. Our instructions for authors have been updated and will continue to be updated. I think it will just take time to kind of move forward into the process.
Yeah, but I think in general, even instructions to authors are a very, very weak intervention. And the fact is, unless you have someone actively monitoring this, which few journals can afford to do because they don't have the money to have the manpower to do that degree of scrutiny, it's really, really hard to change. This should be straightforward in a way. I mean, it's a simple thing. I mean, there are complexities about all these issues, but whatever your decisions are about the rules, it's a simple thing. Yet just getting that correct in the published issues remains a challenge and will be, particularly for journals that are less resourced than the major journals like JAMA.
Absolutely. Although we were heartened by at least that the final products were a little bit more clear and accurate and sensitive. And yes, it was a lot of times after acceptance where the editors did a lot of that work, but we are hopeful that we can move it upstream. Thank you.
And then we'll take online after you.
Denise Goodman, Northwestern University, Chicago, and also an associate editor at Journal of Pediatrics. Kudos on implementing a really important guideline and showing that it affects change. How do you recommend we counsel authors who are trying to adhere to this under certain circumstances where the information is unknowable? for instance, many administrative large databases, or they may comprise multiple years where the various categories changed. And so for expediency, things are collapsed and obscures some of the differences, and yet trying to expand it might be beyond the scope of what the author can accomplish. How do you recommend we proceed in those situations?
That's a really good question. And I think something to bring back to my research colleagues and I too, we didn't look at anything that was a database study. So that is definitely something we'll need to explore. Thank you for that question.
Thanks. Thanks, Stacy. Two questions from online. Annabelle Andon observes or wonders if these are nationally or geographically specific. For example, race and ethnicity are, as categories are defined differently across countries and societies. So how do you or we manage that? And just to get in the other one, Bahar Mimani from Elsevier asks if we've seen association between the author's own race and ethnicity, age, and county of affiliation with adherence to the new guidelines.
Thank you. To the second question, we didn't look necessarily at the authors where they were from, but again, we do still have the database of the studies, and it's certainly something we can go back. In as much as we can accurately identify that, we can look and see if there's any kind of correlation. To the answer to the first question, 40% of our studies were international, so this was not just a US-based exercise. And we trust, like we do for everything we publish, we trust the authors to be as accurate, clear, and consistent as possible. And we read word for word through all of these articles to glean any information we could about what was reported, including the supplements.
Hi, Carissa Cooney from Johns Hopkins. I'm wondering what the publication lag time is from submission to publication in these journals.
In these journals, isn't that here? Can help me out. JAMA is going to be a different answer than the other two journals.
Just approximately.
From submission to publication or acceptance to publication?
I mean, both.
Acceptance to publication, I know a little closer. It's usually 6 to 8 weeks, except JAMA is much faster. So if you want to get published fast, submit to JAMA.
Yeah, I was planning.
Shameful.
Yeah, no. And then submission to publication, of course, depends a lot on author revision time. But we tend to see somewhere between 2 and 4 or 5 months. A good chunk of that time is author revision and often multiple revisions.
Because my point there would just be, it would be very interesting to see this study done in another year when authors are potentially having time to proactively include this information in their manuscripts. And then also it'll be interesting to see how it evolves over time as they're able to include this information prospectively in the data collection phases.
Yeah, thank you. I think that will be an excellent follow-up study. And like I said, we'll also be looking at sex and gender language and age, language used to talk about participants' age. So this could be a series of ongoing research. Thank you.
Malichki Mario, Stanford University. If we consider this to be really an important issue, why don't journals implement this as a statement? Why not have this as a conflict of interest statement or ethical approval statement or data sharing statement? Why not have an ethics and race statement so that you have a designated area within the article where this needs to be reported? And that way it's not left to, will someone read a instruction to authors or will they read a guideline that is published? It needs to be required to be reported.
Good. So the question was about making this a requirement and making sure that it's published in every single article. We are working towards that. We have asked authors who don't report race and ethnicity why you didn't collect these data, and sometimes they have a very good reason for it. But so far, we're working on including this as much as possible, but we also need to, in the future, not too distant future, to weave in sex and gender and age. And there will probably need to be a reporting section in the methods as well as in the results. I do know one journal has included this as a checklist, a nephrology journal. And so authors are required to check off the consort, check off conflict of interest, and also check off the race and ethnicity reporting and making sure that is in their publications. So I think that is a very strong approach to making sure it is complete and accurate.
Well, thank you, Stacy.
Thank you.